This is Goal 6, Module 2. Basically, it's to name the bone parts and name the bones. It will be used mostly for lab. So we're going to talk about the bones and the major features. See your master list for the entire thing that you need to know, or all the ones that you do need to know. Here's a skeleton with some of the major bones listed on here. The hardest part about the bone chapter is not naming the bones, but naming the bone parts. So I will define each one of these quickly here. You can see this list also in your atlas. Bones have features. They have holes, little indentations, ridges, etc. And each one of these means something. And you'll be naming one or two of these on the different bones from the body as you go through your lab list. You'll notice some of these words. A canal or a meatus is a large passageway through a bone. A process is any projection or bump. A sinus is a chamber, usually filled with air. A foramen is a hole in a bone, and a foramina is a small hole. A fissure is an elongated cleft or gap. A trochanter is a large rough projection, usually connected by a neck to the main part of the bone. A facet is a small, flat, articular surface. Articular is where bone rubs against another bone to move. Condyle is a smooth, rounded, articular process, again, where two bones are touching each other. Head is an expanded proximal end of a bone, usually a rounded part that forms a joint. A tubercle is a small, rounded projection. A sulcus is a deep, narrow groove. A tuberosity is a small, rough projection. A trochlea is a smooth, groove, articular process, usually shaped like a pulley. Crest is a prominent ridge. A fossa is a shallow depression. A line is more delicate than a crest, kind of a low ridge. A spine is a pointed or narrow process, and a ramus is a thick extension that makes an angle with the main body of the bone. So the skeleton is divided into the axial and appendicular skeleton. The axial skeleton contains the skull, so all the cranial and facial bones, so your head and your thorax or your ribs. The hyoid bone is in your neck and it supports your tongue. It's actually a bone that's missing on the skeleton and that's hanging in the classroom because it's not attached to another bone, so it would just have to float there. The vertebrae are included in the axial skeleton as well. Cervical, thoracic, lumbar, sacral, and coccyx. The appendicular skeleton includes your arms and legs and your hip and shoulder joints. So it includes all of those bones. So we're going to start with the skull bones. There are 22 of them total. They're sometimes difficult to see the lines between them, so look at the skulls very carefully in lab. The mandible is the only movable bone on the entire skull. Okay, and of course the cranial bones encase the brain. It's very protective. In the skull there are 4 sinuses. They help reduce the weight of the skull because they're filled with air. They are lined with mucous membranes, which can change the intensity of your voice because they resonate sound. It's also why you sound funny when your sinuses are plugged up. So here's a picture of the cranial bones. The frontal bone here is in orange. The parietal bone is in blue. The occipital bone is in orange in the back of the head. The temporal bone is the red one, has lots of things sticking off of that. You'll be looking at those in lab. The sphenoid bone is purple here, but it is seen better when you're looking down at the skull if it's open at the top. And the ethmoid bone. The ethmoid bone helps form part of it's the little purple one here, part of the nose and eye cavities. The sinuses there's 2 of them in the ethmoid bone. There's 2 of them in the sphenoid bone. There's also sinuses in the frontal bone and the maxillary bones. Here's a picture of some of the facial bones. Maxillary is the upper jawbone. The palatine bone, which you can't see on this picture, is the roof of your mouth, the hard palate. The zygomatic is the green bone here that forms your cheek. And the lacrimal bone is inside of your eye. It's where your tears come out of. Facing on, or face-on view of the cranial bones, you can see the nasal bone forms the nose, and also has some flaps there that increase the surface area inside your nose, called the nasal concha. The vomer bone forms the bottom half of the naval septum. The top half is actually part of the ethmoid bone, so the two together form the nasal septum. The inferior nasal concha, again, are the darker blue flaps. And the mandible, which is the lower jawbone. You can see there's sutures that attach these bones. Also in the previous picture, you can see these sutures. They all have names. Those sutures don't form completely until you're 2 years old. So when a baby is born, there's spaces between the cranial bones called fontanelles, or soft spots, because they have not finished ossifying. This allows the baby's head to be somewhat flexible as it passes through the birth canal. So the vertebrae from skull to pelvis, the first 7 are cervical, then the next 12 are your thoracic, then lumbar. The sacrum starts out as 5 but fuses to 1 by the time you're an adult, and the 4 coccyx bones fuse and become your tailbone. Between each vertebra is an intervertebral disc, and hopefully you remember from the connective tissue module that contains fibrocartilage, which acts as a cushion between each one of those bones. They are connected by ligaments. Ligaments attach bones to allow some flexibility and movement. So here's a picture of a vertebra. You should know the parts of the vertebra. The body is this main part right here. It's attached by pedicles to the transverse processes, which stick out right and left, and the spinous process, which sticks straight posterior. So when somebody feels the bumps of your backbone, they're actually feeling the spinous processes. There's a hole between the body and the spinous process called the vertebral foramen, and that's where your spinal cord would be. The cervical vertebrae are the smallest in the top 7. They are distinguished because in the transverse process there's tiny little holes called vertebral foramen to allow blood vessels and nerves to travel through. The very topmost vertebra is the atlas, and the second one is the axis, and that's what is shown in the picture here. This is the atlas, and these little facets here rub against the condyles on the bottom of the occipital lobe, or occipital bone, and it allows you to nod your head. The axis, the second one, this has a little projection called a dens that sticks up right into the atlas, and it allows these two bones to rotate against each other, which allows you to shake your head no. The next 12 are the thoracic vertebra. Each one of them is attached to a rib, and they have the longest spinous process of the 5 types of vertebra, and they get thicker, or the body of it gets bigger as you go down the back. The next 5 are the lumbar. They look a lot like the thoracic, but one of the ways you can tell is the transverse processes are more straight across. It's almost a 90-degree angle between a spinous and a transverse process in a lumbar vertebra. And the next 5 that fuse to form kind of a triangular structure called the sacrum are fused completely by the time you're 30 or 25 or so. They're wedged between the pelvic bones, and the space between the sacrum and the pelvic or the pubis bone is basically determines your pelvic size, and if it's too narrow, they take your kid by C-section because you couldn't have a baby pass through there. There are little tiny holes here that allow blood vessels and nerves to pass through. The last of your vertebra are your tailbone. This is your coccyx. There's 4 little bones there. They fuse by the time you're 25. It does act as a shock absorber when you sit down. You can sit down too hard and break them, which doesn't feel good, and you don't get a cast. You just have to sit on a cushion for 5 days. Leaning forward when you sit can relieve pressure on your tailbone, which can sometimes actually be a cause of back pain. Alright, your thoracic cage is made of your ribs, and there are 12 pairs of ribs. The first 7 are attached directly to the sternum. These are referred to as your true ribs. The next 5 are called your false ribs, the first 3 of which are attached up at true rib number 7 via cartilage, and the last 2 aren't attached at all in the front and are sometimes called your floating rib or floating ribs. The body of the sternum here is your breastbone. The top is called the manubrium, and the little pointy part at the bottom is called the xiphoid process, and that's where your diaphragm is attached. Your pectoral girdle is essentially your shoulder, your collarbone or clavicle. You can see here, this is from the back, and this is from the front. Goes from your sternum over to your shoulder. The scapula is a flat bone. It has a spine, and the groove above it is called the supraspinous fossa, and the groove below it is called the infraspinous fossa. It has 2 projections off of it, the acromial process, which becomes your shoulder, point of shoulder, and the coracoid process. Both of those processes attach tendons and ligaments and muscles, etc. As you go down your arm, you have the humerus, which is the long bone here. It articulates with the ulna, which is the one with the little U shape. That's how I remember that here. And the radius has a round top because it allows your arm to rotate back and or twist your wrist, I guess, if you want to think of it that way. And then you have carpal bones, which are your wrist bones. There are 8 of them. Metacarpals, which form the palm of your hand, and phalanges, which form your fingers. Here's a good x-ray picture of your carpals, metacarpals, and phalanges. Your hip joints, or your coxal bones, are actually 3 bones fused together. The ilium in yellow, the pubis kind of in this peach color, and the ischium in the purple color. Okay. The male versus the female pelvis is slightly different shape. This is a male pelvis. The ilium are tipped out more in women. We don't have to wear belts because of that, because we have hip bones that stick out, but it allows us to give birth. The leg bone is the longest bone in your body, and the largest is the femur. The patella is your knee bone. The tibia is the weight-bearing large bone in the lower leg. In fact, if you break your fibula, the small one, you don't get a cast because it doesn't bear weight. Then your ankle bones are known as your tarsals. Here's a close-up picture of your ankle bone. The heel bone is called your calcaneus, and the bone the tibia rocks on is called the talus. And then your metatarsals form most of your foot, and your toe bones, also called phalanges, just like your fingers. Okay. And don't forget, all these pictures are in your atlas. Use your lab book to get your master list, and then we'll work with the bones in class.